I'm going to call the meeting to order. Please welcome the Human Services Reform, Finance, and Policy Bill to the first of several marathon sessions. And just so people know the plan, we're going to do like 10 or 12 bills today. Thursday is going to be a semi-normal day. We're going into the evening. We're going to reconvene at 5. And then for purposes of time certain, 1350. So we're not going to take up until after 5, Senate File 1350, Senate File 709, Senate File 933, and Senate File 1075. It'd be wonderful to get through the rest of the bills by then, but we'll just do what we do. Thursday is going to be a normal day. Tuesday next week, Senator Rosen will just want to come be part of our 23 bills that day. And so many of those we've heard somewhere else, and so each bill has been given a target time of 5, 10, 15, and 20 minutes. And so with that model, we'll get out of here before the dawn. We're trying to give every bill its due diligence, and just because we have a schedule doesn't mean we need to rush through anything. And so if any member has a question or a comment they feel inclined to offer, we are certainly going to entertain that. However, I'm particularly interested to hear from the public if they have concerns about a bill. We kind of think the things we're hearing are reasonable, or at least they make a good Senate position, and we'll be discussing that with the department at some point to find a good resolution to the concerns that we're bringing, but so that's on our mind. And then so Tuesday is going to be the longest day, and then Thursday we're going to start to go through some of the committees ferreting out some of the more thorny issues that we've been dealing with, substance use disorder, min choices, waivers, and so on. And that will likely continue through Tuesday, the week following that. And I don't know what happens then. And then we're going to be putting our omnibus bill together, which will happen at the end of that week and over the break. So hopefully that'll be unveiled early in the week when we get back from Easter, and with the goal to pass that thing out by certainly by Friday and hopefully by Thursday that week. That's the general plan. So with that, Senator Rosen, you have the Minnesota Telehealth Act. And just so the public knows and committee members, we're limiting our discussion here not to the entire breadth of this marvelous act, but to the breadth of matters that come into our purview. And so, Senator Rosen, if you can help me, if some questions come up that are unrelated, you can just, this is going to wind up back in the other Health and Human Services Committee later for those kind of matters. So I'd really like not to take up any of that. So Senator Rosen, to your bill.
Thank you very much.
Senator Benson will move Senate File 1160 to be before us.
Thank you, Mr. Chair and Senator Benson. This bill has been before Health and Human Services, Senator Benson. It's been to Commerce, now in front of you, Senator Abler, Mr. Chair, and then it goes back to Senator Benson's committee with a fiscal note, which I do not have at this point. But telehealth has been around since 2015. It was telemedicine at that time. And because of COVID-19, it has really been expanded. We're seeing increases up to 30% of visits in June of last year, whereas before it was 2% of the visits. It will not replace in-person visits with your provider. Absolutely not, but it is a very important option for the patient and a critical tool in delivering health care. It is, telehealth is here to stay, and the conversation needs to continue on the whole gamut of parity and ongoing, and those conversations are continuing, but we have not come to an agreement. Or parity has been in the bill since 2015. It's, you know, in-person an audio or video or a telephone is being paid the same as an in-person. But Senate File 1160 is a cleaner, updated version of the current law. And there is, of course, a change from telemedicine to telehealth. So the bill looks a lot bigger than what it really is. But there are a number of critical changes that codify the changes made through the governor's executive orders. One is redefining the original site to allow services to be provided wherever the patient is located, including the patient's home. The old law required the patient to go to the hospital or clinic to receive telehealth services. We also, in this bill, remove the arbitrary limit of 3 telehealth visits per enrollee per week that exists for MA enrollees. This has been extremely important for mental health delivery and substance abuse delivery. It includes a telephone-only services in the definition of telehealth if those services are a part of a scheduled patient appointment and the standard of care for the service can be met through audio-only communication. And that's really important. There's always a focus on the standard of care that the physicians have to rely on. Allowing audio communication is current law, but wasn't used much until COVID-19. It also, in this bill, includes coverage for remote telemonitoring services for patients with conditions where it's medically appropriate. And, Mr. Chair, there is an A15 amendment that deals with a few of the issues that came up in Senator Benson's committee and in Commerce. And we all know that no-shows have drastically decreased. It's been very effective in making sure that we utilize our money well. And like I said, it's very effective in the area of mental health and substance use disorder services. Nothing in this bill on page 3, line 24, I just want to reiterate, nothing in this bill requires patients or providers to use telehealth. The provider has the right and the responsibility to determine if telehealth is appropriate, and a patient has the right to choose not to receive care through telehealth. There are 2 items that I'd like to bring up that are concerns from the payers and the business community, and it's the prohibition on telehealth-only networks and a requirement for payment parity for telehealth. And like I said, parity is current law for private coverage. This is not new. With that, Mr. Chair, I do have the A4 amendment. I have several amendments, and I'm not sure if, but the A14 amendment does put the bill in order if that's that's one that's a little more detailed, but it's very important to moving this bill forward. And what it does is expands telemonitoring service coverages under MA as we have in the bill right now to include more situations. The telemonitoring services would need to be medically appropriate, likely to prevent a hospital, ER, or nursing facility administration or readmission, and the recipient would need to be capable to operate the device or equipment, and the recipient would have to reside in an appropriate setting. And this is on page 5, line 12. This is, I think, really an important piece to this amendment is to make sure that we get telemonitoring right. That's where you're going to see your cost savings. It also clarifies that mental health case management services to a child may be offered through telehealth. There was some confusion in the previous language of this bill, Mr. Chair, and this is directly related to your committee. It also adds several sections from the governor's bill that involve the same sections, whether you're dealing with the assertive community treatment section, which permits the use of telehealth when necessary to ensure the continuation of psychiatric and medication services availability and to maintain provider staffing levels. It also it deals with a children's therapeutic service section by changing the terminology. It deals with the intensive rehabilitative mental health service section, which permits services to be provided through telehealth. And the early intensive developmental and behavioral intervention, EIDBI, distinguishes that travel time reimbursement is only allowed to be billed for an in-person EIDBI service. And adds language that permits the use of telehealth visits through audio and visual communication to satisfy the face-to-face requirement for reimbursements for FQHCs, our rural health clinics, our tribal clinics, and our behavioral health clinics if the service would qualify for payment if performed in person. And that's on page 5, line 6. So those are a few of them. Like I said, those last 5 that I mentioned were in the governor's bill, and we're including that. But that is the A14 amendment, Mr. Chair, and I stand for questions.
Thank you, Senator Rosen, and Senator Benson moves the A14 Questions about the amendment from members? Looking for hands. Senator Wickland.
Thank you, Mr. Chair. I'm curious, do you have any feedback from DHS on this amendment? It's so extensive, I'm trying to process, but does DHS have any comment or feedback on the changes in this amendment?
Senator Rosen.
Mr. Chair, no, I have not heard from DHS. It has been posted. I have not heard from them at all.
I'm sure they're watching. If somebody from the department would like
Yep.
to offer their thoughts, this would be a good time. Who's that going to be? Let's see. Matt? Mr. Burdick, the Al Newman of
Thank you.
DHS, utility player. Welcome.
Thank you, Mr. Chair. For the record, Matt Burdick with the Department of Human Services. We're still analyzing the amendment, and we'll be sure to get feedback to the author in short order here. Just a lot going on with deadline week, so we'll get back with any feedback we have very soon.
Thank you, Mr. Burdick. I can't imagine deadline week for you guys. So Senator Franzen, Wickland, sorry. Is that helpful for now? And you're on the other committee. This will be taking up in the Human Services, in the Health and Human Services Committee as well. So.
Thank you, Mr. Chair. Yes, as long as it's coming back there,
right.
that's good to know. Thank you.
With a fiscal note, Mr. Chair.
And with a fiscal note. Bonus. Other questions from members? Seeing none, Senator Benson, news or motion to adopt the A14. All in favor say aye. Aye. Opposed?
Aye.
It's adopted. Senator Rosen, do you have another amendment?
I do, Mr. Chair, and there are several here from the March community, and there is the A15 Amendment. And, Mr. Chair, it adds, they want to be specifically mentioned in the bill. Mental health is mentioned in the bill. Get the bill out. Where is it? On the first page, paragraph C. But the treatment coordinator under section 245G.11, the alcohol drug counselor, and the recovery peer would like to be mentioned in this bill. And the treatment coordinator does have a license, but the alcohol and drug counselor and the recovery peer are not licensed, but they meet the requirement, and they think they feel like the community feels that it's important to be designated in this for
Very good.
Private pay.
All right, so Senator Benson moves the A16. Questions to that? I'm sorry, I got the wrong one. What one? A14. I was just. Oh, A15. I was just looking. I'm sorry. It's going to be a long day if we're already doing this now. Senator Benson moves to A15. She withdraws her motion to adopt the other one that we got wrong. So. Questions to the A15 amendment? Don't see any hands. So all in favor of the A15, please say aye. 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 Opposed?
Aye. Aye.
It's adopted. Thank you. And Senator Rosen, do you want to mention the other two, or what would your pleasure be while we're just doing
Mr. Chair,
amendments?
actually, I only have one more, the A16.
Okay.
I don't know
The
if there's
A16.
another one that I'm unaware of.
There was an 11 in the packet, too, so.
That is old, Mr. Chair.
Old news.
Old news, so that
Senator
has been
Benson
around.
now moves the A16. I was just ahead of my time.
The A11 was in the A14, so the A11's been around quite a while.
Okay, thank
And the
you.
A14 just incorporated much more. The A16, again, comes from the March providers, and it deals with the substance use disorder services and mental health services delivered by audio-only telephone if in an emergency or a crisis situation and a scheduled appointment was not possible due to the need of an immediate response. And this is something, Mr. Chair, I think is a really great conversation. I'm not sure if this is necessary at this time. Perhaps it should wait to Senator Benson's committee, but it does get complicated if you are allowing payment for MA through a telephone, but you do not have a scheduled appointment. It does break it open It's part of this conversation of how the parity issue. So I'm just introducing it to you. I want to be respectful of this amendment, but I'm not quite, it's been very effective. These professionals are taking phone calls all the time. They're delivering services. I do believe there should be a parity issue there, but in an emergency, in a crisis situation, I just don't think the conversation has evolved enough to get to this point where the A16 should be adopted in this committee yet.
All right.
But
so-
I would like, I defer to your opinion.
Well, Senator Rosen, you need more open projects in your career here. So I think we can leave this as an open discussion, and then when it gets to the Senator Benson's committee, perhaps you can have it fleshed out. And I would think it's a great idea once you can sort out the details. So as you're going from the world of the fax machine to some enhanced virtual cloud kind of a bill, that's what your bill is doing. It's moving us into modern times. This certainly makes sense. Eventually, people will say, "What's a telephone?" But that need makes sense. So, Senator Benson, you just want to withdraw your motion?
Mr. Chair, I'll withdraw the A16.
Senator Benson withdraws the A16. So the bill is in the order you like. Senator Rosen, do you want to move to testimony?
Mr. Chair, I am not sure.
We have three
who is
testifiers.
testifying at this point.
Well, we'll see if they want to testify. On my list, I have Angela Youngerberg, Dr.
Oh, yes.
Stark, and Kirsten Anderson. So,
Ms. Youngerberger is my constituent.
okay, then I guess we better let her testify. So, so Ms. Youngerberg, welcome back to the committee, wherever you are, in which box.
Hello.
And so just to the testifiers, if you can limit your conversation to what's before this committee and not the big picture, and certainly where you live, Ms. Youngerberg, is exactly where the committee lives. So welcome to the committee.
Thank you. Good afternoon, Mr. Chair and Senators. Thank you for allowing me to testify today. And thank you to Senator Rosen for your leadership on this very important bill. My name is Angela Youngerberg. I'm the Director of Business Operations for Blue Earth County Human Services, testifying today on behalf of MICA, which is the Minnesota Intercounty Association, and MACSA, the Minnesota Association of County Social Services Administrators, representing all 87 Minnesota counties. I'll get that name right. Counties support the nature of this bill and the amendments and what it hopes to achieve. This is absolutely a necessary advancement of policy that's critical to maintaining the improved access for individuals receiving case management services. And counties, as you know, are responsible for case management services and have a vested interest in the details surrounding case management. The one thing that I have for testimony today specific to this bill is that in the spirit of administrative and program simplification, while at the same time upholding service quality, best practices, individual choice, counties would like to see uniform language regarding what it means to provide services by telehealth through all forms of targeted case management. And so the language today is so very close to achieving this goal, with the exception of permissive language surrounding child welfare targeted case management. Leaving this one singular form of case management without this really important tool of telehealth would be confusing for those providing the services, but even more so for those that we serve, that are going to be and have been already used to receiving services when they want to, when it's appropriate, through telehealth services. So we believe that there's value in offering consistency regarding access to these services when it's agreeable, when it's appropriate by all involved in the visit. And so we look forward to working with Senator Rosen on language that helps to achieve the goal of uniformity in how telehealth is accepted in all forms of targeted case management. Thank you very much for allowing me to testify today.
And Senator Rosen, I presume you're familiar with this, the detail that's being brought forward by this great county to the south?
Blue Earth, Mr. Chair, Blue Earth County just rocks, and what Ms. Youngerberger has done in that county with Yellow Line Project, which you're all familiar, that is Ms. Youngerberger. Apparently, there's a further tweak necessary to get the child welfare target case management exactly right. I don't have the language yet. I just got this just as I sat down. So
No, good.
that, when we go to your committee, Senator Benson, I will have further.
Perfect. I expected no less, just bringing it up so that the county people can know that you're you're on it. So,
Yep.
Dr. Stark, welcome to the committee.
Thank you. Dr. Tricia Stark, licensed psychologist with the Minnesota Psychological Association. COVID has had an enormous impact on our society, and one of the positive outcomes has been the expansion of the use of telehealth services to more individuals to be able to access mental health services. And this bill seeks to make permanent the adjustments to the telehealth, which have been so successful at engaging people just when the needs for mental health services have skyrocketed, with the CDC estimating a 40% increase in individuals reporting struggles with mental illness and substance use disorders. Several aspects of this bill are extremely important to addressing unmet mental health needs. The change in both originating and distant site, allowing multiple sessions of telehealth for the provision of services. Continuation of audio-only services is extremely important. Phone-only services has opened up care to previously underserved populations, such as rural individuals, the elderly, and typically disenfranchised groups. A telling example came from a psychologist who does a support group for women in domestic violence situations. Because they can now join by phone, she has had numerous women in difficult situations from across the state join the support group so that they are now getting help. Of grave concern is the need to maintain the same provider networks as are in place for in-person care. Minnesota has made huge strides in the area of care coordination, and the use of virtual networks, especially for mental health, would risk patients once again falling through the cracks. Using national telehealth networks may disrupt the continuity and coordination of care with local providers. Mental health treatment relies on the relationship between the provider and patient. It may be feasible to see a different provider each time you have a sinus infection, but this simply will not work for mental health services. Thank you for this opportunity, and please support Senate File 1160.
Well, thank you, Dr. Stark. And just for one person here, I share your concern about virtual networks and figure they'll have 4 people in Idaho or someplace. So Ms. Anderson, welcome to the committee.
Good afternoon. My name is Kirsten Anderson, and I'm the Executive Director of Aspire Minnesota, a statewide association of children's service providers. We are grateful to Senator Rosen and this committee for your thoughtful inclusion of children's mental health priorities in the A14. Sustaining telehealth innovations will maintain the positive impacts telehealth has delivered to children and families throughout this pandemic. Specifically, we appreciate your inclusion of children's mental health targeted case management, a service designed to support children with intensive mental health needs to be their best at home and in the community, with the goal of preventing placement out of the home in a residential or hospital level of care. Case managers work with parents and mental health providers to identify therapeutic, social, educational, medical, fiscal, and other formal and informal supports. COVID waiver flexibility to deliver children's mental health targeted case management via telehealth yielded a positive impact for many families, with enhanced engagement and participation resulting in more coordinated and active support for children. Successes shared by community-based providers include, for families working multiple jobs, adding a face-to-face visit every month can be a barrier. With telehealth, parents have been meeting more consistently with case managers because they have more flexibility, meeting in their cars, on their lunch breaks, and in downtimes. Telehealth has been extremely helpful for children whose mental health concerns have produced extreme fear around meeting providers in person. Families who are at risk due to complex medical conditions can safely engage through telehealth. And some young people receiving services have been much more engaged through virtual sessions with case managers and report building very positive relationships with previously really hard to reach young people. In short, telehealth has been the best innovation for client-centered responses and offering individualized services to each family, while of course maintaining that in-person services are ideal whenever possible. Clearly, telehealth flexibilities have made a meaningful difference for this important area of service for kids and families, and we again are very grateful to your support to sustain this meaningful innovation. Thank you.
Well, thank you very much. And there's written testimony from the Minnesota Medical Association, March, Mankato Clinic, Minnesota Society of Health System Pharmacists, and a whole group of people, Medical Alley, Minnesota Association of Community Mental Health Programs, Minnesota Business Partnership, and Alina Health. I'll just remind the public as they're writing letters to us, if you like it, that's a good way to make your concerns known. If you do not like something in a bill, a letter is a good start, but you'd better reach out in some way, especially given COVID. And I just want to commend my committee administrator. There are 53 items today on the attachment list that I counted, and that's just a remarkable amount of work to put this together. So with that, Senator Rosen, should we just do questions now?
Absolutely, thank you.
So Senator Rosen stands for questions. Questions from members. Senator Hoffman.
Thank you, Mr. Chair, and thank you, Senator Rosen, for doing this. This is a great thing to see, these themes of telemedicine. We know stuff is working out there, and how do we enhance that? And you're going to be going down that rabbit hole on parity, non-parity. How do you get this? How do you get that? So I give you lots of kudos to that. So I guess I have one question. On line 5.8, and I'm wondering if we already have a definition of healthcare staff, because as I read that, is that do you know if there's already a definition of healthcare staff within statute or within this bill? Do you know?
Senator Rosen.
Mr. Chair and Senator Hoffman, I don't know if there is, and perhaps Ms. Kavanaugh would know.
Yeah, Ms. Kavanaugh, welcome to this committee. I think this is just a unique privilege for probably all of us here. So welcome to the committee.
Well, Mr. Chair, you might see me a little bit more since Mr. Hauswald is unavailable for the next 3 weeks.
Well, that's great news.
Senator Hoffman, I don't believe there is. Basically, this is healthcare staff on site would be, the staff that would be doing the telemonitoring type services in the facility. So, so you're having the patient isn't in, a nursing facility or assisted living facility or somewhere where there is already staff on site that would be doing this sort of, monitoring is the idea behind that. And maybe you're right, maybe there needs to be a little bit more definition into what is meant by healthcare staff.
Thank you, so Mr. Chair. Thank you, Mr. Chair. So, because what comes up is the in-home health care, right? What if, and this is just a what if, I mean, it just dawned on me, what if that the person at home, there was an unpaid caregiver, right? But that person was at home, and that caregiver, would that necessarily not qualify that individual at their home for telemedicine? And if it's not an issue, not, but it just dawned on me. I didn't want to be loosey-goosey on anything, Senator Rosen, but I wanted to make sure that there was some clarity, because you never know, unless we have some clarity, right, that someone's going to go, I wonder if that happens. And if it doesn't pop, it doesn't pop. But that just dawned on me, and I thought I'd ask that. Do you like my loosey-goosey comment?
Well, Senator Hoffman, I did, but just actually raised Senator Rosen, can you just tell me what your intent is? If there's a pediatric home care setting where the person has high needs and they're in their home, serving by nurses that come and go, are they eligible for?
Oh, absolutely.
And so that doesn't affect that at all?
No, not at all.
Okay,
No.
just making sure.
No.
Yeah, thank you.
Yeah, no, that's good to hear, Senator Abler, and I thank you for fleshing that out.
Yeah, and it's actually good to hear the intent. Any other questions from members? I don't see anybody unmuting. Staff, anybody? So if I missed you, Senator Rosen, I guess you get the last word, and we'll send this bill on its way.
And I just know every time I'm in front of Senator Hoffman, it's going to be a loosey-goosey conversation. Mr. Chair and members, I know this is a work in progress, and I always hate to talk about a bill like this, but this is a tremendous movement in this area, and we want to make sure we get it right. There's a lot of talk about value-based outcomes and access and the quality of the visit, the innovations, the payment. Parity has always been in the bill since 2015. We fought hard in 2015 for that measure. I'm not interested in going backwards. I'm not interested in penalizing telemedicine, or telehealth, excuse me, I got used to the right word, for being successful. But I am interested in fairness, and I'm interested in making it accessible ongoing. I think we are probably at the max of our telehealth visits and access, and it's about 30%, 20 to 30%. It's never going to replace an in-person. It's not meant to, it's supposed to just be, it's supposed to be for the patient. And this is what it's all about, is the patient, making sure they get the care. And COVID has brought this to the forefront. So it's extremely important for our seniors, our disadvantaged, our rural, our underserved, our folks that are suffering from mental health and our substance use disorders. And so let's make sure we get this right. So conversations are continuing on with the issues that the plans have. But like I said, I'm not interested in penalizing the parity issue. I want to make this fair. So I know the House is looking at a study. I'd like to push this farther than a study and see if we can get this right. So conversations are happening. So, Mr. Chair, thank you very much, members, and I appreciate your support on 1160.
Well, very good. Seeing no more questions, Senator Benson renews her motion that Senate File 1160 as amended be recommended to pass and be referred to the Committee on Health and Human Services. Everybody understand that motion? All in favor say aye. 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 Opposed? The motion prevails. The bill is re-referred. Thank you, Senator Rosen.
And thank you, Mr. Chair.
That's a lot of work and good for you. So now Senator Utke will move Senate File 1558 to be before us. Senator Rosen.
And Mr. Chair, before we go to Senate File 1558, I did have your Senate File 200, telemonitoring for COPD patients, was going to talk about, but perhaps we can talk about it in Senator Benson's committee.
Oh, did you want to bring that up now?
I don't know.
Well, it's germane to the topic. I mean,
Yeah, and I forgot to bring it up and wondering if you wanted to amend it on, but we'll talk about that offline.
well, why don't you just mention it, and then we can take that off. I did not prepare an amendment.
Oh, okay.
But I was actually trying to defer to you and how you want to handle this.
I had
But
it
I
out,
would
Mr.
think that'd be
Chair.
great. So if you just want to mention it, then the public can be aware that it may be taken up at the next stop.
Yeah, it looks like there is great potential to save money on the ME programs, and it has fewer visits to the offices, the ER rooms, the hospitalizations for people suffering from COPD, and the respiratory therapist would like Senate File 200 to be perhaps amended onto this past bill that we just finished.
Well, thank you, Senator Rosen.
My
and
apologies.
perhaps, I don't know how you're going to do the fiscal note, but perhaps they could fiscal note that amendment, just so then you'll know what your bill looks like. So
I will look
with
into that. Thank you.
I appreciate the discussion. So now, Senate File 1558, Senator Utke moves.
Thank you. Thank you very much, Mr. Chair, members. This is a wonderful bill. I am very, very excited about Senate File 1558. It's the foster care licensing bill, and it's long overdue. And I can remember being appointed by Governor Dayton to the Child Protection Task Force with Senator Sharon. And that was the most intense task force I've ever been on. And I served on Chief Justice Kathleen Blatt's subcommittee on training and, what was it, training and assessments. There was different levels, and we came out with a wonderful child protection bill back about 7 years ago. Well, we could never address foster care. It was always divided, extremely divided on how you deal with licensures in foster care. This is 4 years in the making, Senate File 1558. So all parties have really come to the table and hammered out this bill. And research shows that children experience better outcomes when placed in relative foster care setting as opposed to being placed in a non-relative foster care setting. Minnesota's current requirements have over 100 crimes, and many unrelated to child safety, that temporarily or permanently disqualify potential foster care parents from receiving licenses. Other states have already modified their licensing standards to align with standards set by federal government and adoption standards. And research shows that a child is more likely to thrive when placed with a relative There is an emotional and culturally significant component resulting from a stable placement. There's less separation of siblings and a stronger community connection. The main purpose of this bill is to bring Minnesota foster care licensing standard more in line with our adoption standards, to remove unnecessary barriers that exist in current law for relatives in especially communities of color seeking foster care licenses, and to ensure the well-being and stability of children. And I have, excuse me, Mr. Chair, Native American children are 17 times more likely to experience out-of-home placement, and African American children are 3 times more likely than their white counterparts. Current Minnesota law creates problems for placing these children in permanent safe homes. And I cannot stress enough the amount of work that has gone into this bill. Aspire Minnesota, Village Arms, Minnesota County Attorneys Association, Safe Passage for Children of Minnesota, Lutheran Social Services, Minnesota Social Services Association, Institute to Transform Child Protection, One Stop for Minnesota Counties, and DHS have all signed off on this bill. Mr. Chair, I do have the A1 amendment that will put it more in line, and then if I could, I'll go through the summary, and then I'll ask for help from Max Page, the Hennepin County Attorney, to fill in the blanks.
Senator Utke moves to A1. Senator Rosen, maybe you can just describe it for us, please.
Thank you, Mr. Chair and Senator Utke. Number one, it deals with probation and parole. The amended language allows counties to receive information about parole and probation requirements of individuals applying for a license if those individuals agree to sign a waiver of consent. Number two deals with a TPR, the termination of parental rights language, and changes current law to be more restrictive and now requires that individuals who have had a prior involuntary or voluntary termination of parental right, they will be barred from qualification for 20 years. It used to be 15 years. It is likely that DHS and counties will need to plan for this shift in the law through new guidance before the bill is implemented in 2022, including a new publication of the requirements to notify those impacted who are not likely to be aware of the change. The amendment also requires DHS to create foster care guidelines for counties to ensure consistency in licensing practice around the state. And these guidelines and new standards must be in place by 2023. That is the A1 amendment, Mr. Chair.
And Senator Rosen, I just have a question. So it sounds like you're actually increasing the disqualification time from 15 to 20 years, and some of these you're making them more focused. And can you just comment why this particular list needs to be lengthened?
Absolutely. In the past, Mr. Chair, in the old guidelines, there was 7 different years, 15 years, 10 years, and 7 years, and all the crimes were in there. But they have eliminated crimes, property crimes. They have really focused everything down to just 5 years, and depending on your probation or conviction, that's determining when that 5 years starts. So it's either 5 years for crimes or it's a 20-year for TPR, termination. And those are the 2 levels. There's not all these levels. So there has been a laser focus on the level of crimes in the bill, and that is starts on page.
No, I appreciate the focus that I saw. So
11.14 is
if you can just,
when that starts.
so what would the list of things be that make you a 20-year person? You already, I mean, the list has murder and trafficking and all kinds of other things. So what would get you, so what goes, if it was okay for 15 before, why would you go to 20? I guess that's my question.
That would start on 12.22, a gross misdemeanor for assault in the 5th degree, domestic, neglect or endangerment of a child, criminal, malicious punishment of a child, interference with privacy, stalking, indecent exposure.
Yeah.
That's on, starts page 12.22, yep. So the old system, the foster care provider could be licensed by DHS with background studies and then apply for a variance. And like I said, there was different crimes with different disqualifying crimes of 15, 10, and 7 years. It was very confusing, and the crimes dealing with it was very confusing on how to deal with this. So as I said, property crimes have been removed. So stealing, bashing up a property, something like that.
Okay.
Those have all been removed. This new system is really focusing on the children. And then there's determinations from the social worker that start on page 4. And the social worker has a lot more responsibility, which is good, because it's all about the children. They have to look at the type of offense, the number of offenses, the nature of the offense, the age of the individual at the time of the offense, the length of time that has elapsed from the last offense, and the relationship and capacity of care for the child. And then the social worker must look at the evidence of rehabilitation, and this is new for this area of foster care. And they look by if the person who's seeking a license is maintaining a stable and a safe residence, maintaining a continuous and regular stable employment, a successful education and job training program, has a positive involvement with community or family, and is compliance with their probation or parole. If the individual has a substance use disorder, a mental health illness, or has conduct has involved domestic violence, they must have completed an SUD treatment program, a mental health therapy or treatment program, or anger management with no orders of protection since a previous offense. And then when considering a license, they also must consider a written testimony of support, demonstrate remorse and positive behavior. There must be some kind of maintaining of the child's relationship with the family. And then when there is this recommendation from the social worker to the commissioner can deny or revoke a license, and the county or private licensing agency must send a summary of the review and the recommendation. So we have basically a background study that's more definite of what's happening. You have 87 counties all on one level. You don't have all these different measures by 87 different counties. It's much greater, it's much more rigorous, it's legitimate while still focusing on what's best for the child. And that's pretty much it.
I appreciate that,
I'm
yes.
missing the 5-year, and I would really like to defer to Max Page on explaining how the 5-year is instigated.
And so I'm personally comfortable with the work of the committee. But I do have a question. I'll ask him that question too. But I have worked as much as anybody to try to find ways. Back in 2005, it all changed. There could be no more set-asides, and so many people were barred that were perfectly good to serve as a foster parent or a DHS employee. And I realize this is just about foster parenting, and I'm hoping for more work on the rest. So I think it's great that you've worked so hard on this, so I'm all in for that. So my only question is, and maybe I'll ask Mr. Page if you're there, and so my concern is the opposite of coming down more forcefully. The commissioner can always say no. This gives them, the commissioner has the authority to allow a license to go forward, but if they have any concerns, they'll say no, right, Senator
Right.
Rosen?
Mr. Chair.
And so that's why I was wondering why you're going from 15 to 20 years for a finite list that, when maybe some of those folks would be okay. So I have no amendment, I'm not going to touch the language of the bill, but Mr. Page, if you could please answer that question, how 15 years was good enough before, and now it's suddenly needs to be more. So if you're there, Mr. Page. There you are. You're muted, sir. There you go. Oh, you're muted on your device, maybe. I'll act it out. You have to act out your testimony.
Oh, no.
Do you want to? Looks like you're unmuted on this end.
Can you hear me, Thomas?
There we go.
All right.
Thank you.
There we go. Thank you, Mr. Chair, and good afternoon, members. To the question about 15 years versus 20 years, I just want to clarify that current law states that if you have an involuntary termination of parental rights, that's a 15-year disqualification period. If you have a voluntary termination of parental rights, there's no disqualification period. You can become licensed for foster care, in the immediate future. Senator Rosen accurately described that this bill has been negotiated for the last 4 years, and there were some in the group that believed that any termination of parental rights should be a permanent disqualification, and there were others that wanted it to be not quite that restrictive and not as restrictive as 20. I think in the original bill, the involuntary termination of parental rights was going to be a permanent disqualification, and a voluntary termination of parental rights would have been a 5-year disqualification. The two groups, who wanted permanent disqualification in the shorter periods, agreed that, in the middle essentially is 20, but there was no magic formula for determining that.
Well, I appreciate that. And so my interest in asking the question, and you could probably decide what group I would have been on, not to, free everybody to do everything, but with careful oversight to let people who are truly remediated to serve. So I'm not going to mess up your negotiations, and I understand the work that this means. So, but just from my point of view, I think 15 would have been fine. So other questions from members?
Mr. Chair,
Senator Rosen.
I know that this was a really important piece, this 15 to 20, for the Chief Justice Blatz, who has her entire career has been focused on children's justice.
And we have one more testifier too, so.
And so that was an area that she felt very passionate about.
That's well said. So I appreciate, this has been quite a challenge. We should adopt the A1 then. Any other questions about the A1? I guess I'm the one that slowed that down. Seeing none, Senator Utke renews his motion to adopt the A1. All in favor, say aye.
Aye.
Opposed? It's adopted. And we have a testifier, and then I think and there's written testimony from Aspire, but Alexis Oberdorfer, did you still want to testify?
Yes, I would.
Please, welcome.
Good afternoon, Chair Abler and members of the committee. My name is Alexis Oberdorfer. I am the president of Children's Home Society of Minnesota and the associate vice president of Lutheran Social Service. I have over 25 years of professional experience in child welfare, and in any given year, we are involved with the placement of over 200 children in foster care and adoption placements. Regardless of which door a family enters, there should be parity in the criteria that we use for foster care and adoption background studies. In 2018, we partnered with one of the metropolitan counties to assist kinship caregivers that needed to be licensed. The kin were specifically identified based off of them having a relationship with a Black child who had entered foster care. And in that year, we served 34 families, and approximately 25% of them needed to request licensing variances. We witnessed how foster care licensing criteria can create barriers for the BIPOC community. In particular, 2 cases stood out to me. Aunt Addie, when her background study was run, she had a charge that showed up from 15 years earlier for check fraud, for which she had paid restitution. We supported her in seeking a licensing variance, and that was granted. Miss Addie was licensed, and she became an amazing resource for her niece and nephew. She provided continuity to their family. She mitigated trauma that they might have experienced because they were being cared for by somebody who was familiar to them. And she was able to support them until they were reunified with their father. In the second case, we worked with Grandma Joy. She unfortunately had lost her daughter to an opioid overdose. During her grief and loss process, she endured a series of obstacles that really made it difficult for her to become licensed. But the major one that we need to talk about here is that she had a charge for economic assistance fraud that was 12 years old. That really was the thing that got in the way. We again supported her to seek a licensing variance. She became licensed, and in the fall of 2018, she received that license and was caring for her 5-year-old granddaughter. And in the spring of 2019, she ended up adopting that granddaughter. I have asked my management team about non-relative foster care homes and adoptive homes that we license. And they inform me that less than 5% of these homes seek a licensing variance. And that just demonstrates some of the disparities that we were talking about today. Research shows that relatives and kin are the most stable placements for children and oftentimes and promote resilience at the same time when a child needs to be in out-of-home placement. We hope that these amendments and this bill is passed and really can work hard at supporting the reduction of disparities in BIPOC communities and child welfare and reduce barriers to relative caregivers to become licensed as foster care providers. I would urge you to pass House File 1287. Thank you for your time today, and I appreciate your allowing me to testify.
Thank you very much. And Mr. Page, did you want to offer any more thoughts? You're certainly welcome to.
Thank you, Mr. Chair. I don't have a lot to add on to what Senator Rosen explained. She did a nice job explaining particularly the goals of aligning foster care licensing standards and adoption standards, addressing racial disparities while also balancing the best interests of children, which are of course paramount in all of these cases that we have. Right now, we have a conviction on a piece of paper, and that's all we have before we tell someone, no, you can't be licensed for foster care. This approach would include, going into the home and ensuring that someone could provide care for the children. So we encourage you to support this. Thank you.
Thank you. Questions from members? I'll just offer my comment and then we'll move the bill along. So I thank you, Senator Rosen. This is, in 2005, there were some tragic circumstances and the legislature reacted along with, with well-intended actions. I believe those actions were an overreaction, or at least they weren't as measured as they might have been. In some areas, they should have really been exactly as they were. But there's just been some tragic stories in families where this bill would have made such a difference in some individuals who remain challenged today. And so hopefully this can get done. And so you have my strong support for it as a fellow person that cares about this, as I believe as the rest of the committee. And so as we've moved along, and I appreciate all your work and the work of the whole task force, that, whatever you call it, that worked on this. This is ready for prime time, and so hopefully this could be the year. So Senator Rosen, you get the last word, and then...
Thank you.
Oh, Senator Nelson, sorry, I didn't see your hand.
Oh, thank you.
You don't get the last word, Senator Rosen. Go ahead, Senator Nelson.
Thank you, Mr. Chair. We do want Senator Rosen to have the last word. I do want to, as a member on that Child Protection Task Force with Senator Rosen, we did do a lot of good things. The interests of the child are paramount. And your legislation today actually just moves that forward. And it's a testament to tenacity. And I really thank you for not giving up and for continuing to work through this with all the stakeholders as well. And I do believe at the end of the day, we'll see better outcomes for our kids, which is what it's all about. So look forward to casting a yes vote and helping you on your way, Senator Rosen.
Thanks, and Senator Nelson, I hope you get to cast a floor vote on this pretty soon. So,
yeah.
Senator Rosen, you get the last word now.
Well, thank you, Mr. Chair, and thank you very much for the kind words. But this is not my doing. This is just a passion, just like you, Mr. Chair. There is a tremendous amount of people that have put so much time into this bill, and Senator Ranum, Jane Ranum, remember? Served with her. She's been very active in this bill. Sarah Erickson, and of course, Chief Justice Kathleen Blatz, and many, many others, Mr. Page. I mean, it just goes on and on. But this has a long way to go. It has to go to Senator Matthews' committee and Senator Limmer's committee, open to improving it. But like I said, this has been a great compromise. It addresses the issues of racial disparities that are legitimate. while still keeping the child safe and keeping them in a loving home. So with that, I really do appreciate your support.
Thank you. And with that, Senator Utke renews his motion that Senate File 1558 is amended, be recommended to pass, and be referred to the Committee on Civil Law. Everybody understand that motion? All in favor say aye.
Aye.
Aye. Opposed? You're on your way, Senator Rosen. Thank you very much.
Mr. Chair and members. It's been great to be in front of your committee.
And if you don't mind, I'd like to add on as an author. So.
That'd be super. Thank you.
Senator Howe, and I just would like to point out as he comes, and live, we've had 2 live senators, that's a record, I think, that the first 2 bills were very major pieces of legislation. Also, the Family First is a major one. The rest of these are important, but we're not going to spend the kind of time we did on this. And so if the testifiers can keep their testimony focused and in just a couple of minutes, that would be awesome. Senator Hoffman is a co-author, so he'll move Senate File 21 to be before us. So, Senator Howe, welcome to the committee. Have we ever had 2 live authors? You're setting a record, Senator Howe.
Thank you, Mr. Chair.
Another first.
I will tell you that I was up in the office and I clicked in on Zoom, so you probably see that I'm on Zoom, but I realized that you were down here in person, and I thought, why not? We don't get this opportunity in very many committees, so I thought I'd come down and join you.
Welcome to the committee.
Thank you. Senate File 21 is not a new idea or a new bill. This bill's been around a little bit. It's the ombudsperson for child care providers. In this time, this day that we're facing with a shortage of daycare providers, a lot of them seem to get scrutinized and by different levels by the county licensors, and they have nowhere to turn. If there's a new child care provider out there that wants to get into the business and get licensed, there's nowhere for them really to go to get assistance and get licensed. So what this does is I had some great success with referring people to the ombudsperson in the Department of Revenue. So I took and patterned the ombudsperson for child care providers after the ombudsperson for revenue. And so after having great success there, that's where I went. So it's actually patterned after that. And I believe that with an ombudsperson for child care, it'll provide the assistance for those family child care providers that we need so badly, especially out in rural Minnesota. So with that, Mr. Chair, I'd like to turn it over to my testifier, Ms. Kelly Martini.
And just before we do that, Senator Hoffman will move your A1 amendment. Was that your desire, Senator Howe?
Thank you, Mr. Chair. It's a technical amendment on
it looks pretty technical and it's posted. So anyway, I understand it just talks about subject to section 1303 subdivision 4, which most of us have memorized. Any questions about the A1? Seeing none, all in favor say aye.
Aye.
Aye. Opposed? It's adopted. And Ms. Cunningham and Ms. Martini, it looks like you could be first, and then Ms. Cunningham. And if you could just be relatively brief in your comments, we'd appreciate that. So, Ms. Martini, do you want to go first?
Yes, sir.
Wherever you are.
Can you hear me?
We can. There you are.
Hello. Okay.
Welcome to the committee.
Thank you. Thank you, Mr. Chair and committee members, for giving me the opportunity to speak today. My name is Kelly Martini, a family child care provider from Avon, Minnesota. I've been caring for children for 22 years. I am also the president of our local daycare association, SBCCA, Stearns Benton Child Care Association. A couple of years ago, I asked my local representative, now Senator Jeff Howe, to sit down with and talk to me about an issue that I questioned. Although it's not my personal story, it's a story from a provider in my community. I had a provider reach out to me and ask me about a correction order she just received. After her licensing visit, while her husband told the licensor about how he was helping his wife do dishes. Yes, I guess husbands need to brag once in a while. This licensor sent her a correction order stating, and I did make a copy and send it to you in the testimony. Quote, I was able to staff the concern of your husband assisting you in your child care in August 2018 after your accident. It has been determined that this is a violation of Minnesota statute, section 245A.50, subdivision 5.A, due to your husband with the care of infants and children. Your correction order regarding this is attached in this letter, unquote. And again, you have a copy. What her licensor didn't or even consider that her husband was doing dishes while his wife was doing her job taking care of the daycare children. He was just doing dishes, not being left alone, not even assisting her in care, just doing dishes. This is just one scenario of many that licensed family child care providers across Minnesota deal with and question. Licensed family child care providers have no one impartial to reach out to about correction orders or negative action orders other than number one, the licensing division, most counties, and then number two, DHS. This would be like fighting a speeding ticket with the officer that just gave you one. Licensed family child care providers have no neutral third party to reach out and discuss the validity of the licensing action. Seeing that there's ombudspersons to have help in various situations like long-term care, foster care, university, mental health, and the list goes on. We providers across Minnesota know that this would help with the ability to be more confident with disagreeing to disagree with a correction order or a negative action order. I ask you to vote yes on Senate File 21 today, and thank you very much for letting me speak.
Thank you, Ms. Martini. And so Ms. Cunningham, welcome.
Hi. Mr. Chair and committee members, thank you for the time today. My name is Cindy Cunningham. I have been a licensed family child care provider in St. Paul for approximately 20 years, and 25 years actually, and I'm the current public policy chairperson for Minnesota Child Care Provider Information Network, MCPIN, which is a 501c3 statewide association for licensed family child care providers. I served as the MCPIN representative on the Family Child Task Force over the past 2 years. I am testifying in support of SF21 for MCPIN, which establishes an Office of Ombudsperson for Family Child Care Providers. This position was strongly supported within the task force membership under the work of Duty 8. Family child care providers are in a constant position of attempting to navigate the disjointed licensing system with no roadmap, and no centralized support. Providers move forward doing their best and frequently wondering if they are doing the right steps. Providers need to have clarity of information in a timely manner, and an ombudsperson position could offer that direction and information. There's need of one central call line where there is access to all information, documents, procedures to direct providers. Having a central phone number would streamline and focus questions for providers. Licensing units have a central line to obtain clarification and direction. Providers need one also. As presented in the bill, it is critical that in this establishment that there is need for the position to be a separate entity from DHS and the licensing unit. There are other systems established which have been successful in assisting with this type of model. The IRS even has an advocate system to give answers and assist in navigating critical situations. School districts have ombudspersons who are separate from the superintendent in answer to the school board. This position must be established outside of political arenas and focus strictly on assisting providers with information and support to navigate licensing challenges. The only concern I have of this bill is that it not get passed. This bill was introduced almost exactly 2 years ago, and it needs to be passed so that providers don't have to wait any longer. Please support Senate File 21. Thank you.
Thank you, Ms. Cunningham. Questions from members? Senator Wickland.
Mr. Chair, I have been a part of a couple different groups that have been looking at childcare back in 2016, 17. I was on a childcare task force that the Senate had, and then I was also part of the Family Childcare Task Force. And this definitely has come up and has been discussed, and I can see the value in having a communications mechanism for providers, and I think it would be beneficial. I would wonder if I could ask if the department has any comments on the specific language in this bill. It's fairly detailed in terms of the language provided as the duties and the way that the person would do this job. And I just wondered if they have any comments on that.
Thank you. Is there someone from the department? Is it Mr. Burdick or somebody else? Oh, no, Ms. Wagner's here.
Ms.
Welcome to the
Wagner's.
committee. Yeah, there you go. Ms. Wagner, did you hear the question? And you're muted. This has got to be the joke of 2021. Bingo.
Sorry about that.
There you go.
Thank you, Mr. Chair. Senator Wickland, members of the committee. Are still kind of assessing the language. It is obviously very thorough and comprehensive. It's good to hear Senator Howe's comments that it was modeled after the revenue department. There's a few pieces in there about, logistically how this would all be operationalized. So we know that this is aligns with a recommendation from the task force, and this had been brought previously. But I think we are trying to make sure that any of the implications around the access to data, there's several pieces in there that we are still looking at.
Thank you. Senator Wickland.
Thank you, Mr. Chair. And I guess regarding that, access to data, for example, where does this bill go anywhere else besides
State government. It's going to state government next, and I don't know where after that.
And will the department be able to provide feedback on specific, aspects of that, data collection or access to data in that committee?
Ms. Wagner.
Yes, we are hoping to speak to the bill author once we've had a chance to kind of finalize our review. There are a few other things we just want to make sure that we understand how it's designed to fit within DHS. So I think there's a few pieces, and I think our ledge people have been reaching out to set up a time with Senator Howe.
Thank you.
So
and
if we do have specific concerns, we'll certainly be offering technical assistance as we do on other bills to try and make sure that it's operationalized and
Well, thank you. And Senator Wickland, and lines 213 to 219, subdivision 4, it has the word data 6 times. So it seemed to me that this might be going to another stop after it leaves state government. So Senator Franzen.
Thank you, Mr. Chair, and thank you, Senator Howe, for bringing the bill. And I'm on mute. No, I'm not. Okay, good.
Hey, that's funny.
I just have a few questions. I don't see a fiscal note. I'm looking around because there's so many bills, and I wonder if there is a fiscal note. Do we have a sense of how much this is going to cost? I mean, it's housed in DHS, but it seems like it would be not just one person in isolation. It would have to be someone who would be integrated into a larger childcare licensing setting. I'm just concerned about just having one person having this load and not have any more support or staff. So I'm assuming it'll get to judiciary because it also has civil action mentioned in some of the language of that this person would also be subject to civil action for their counsel, if you will. So I'm just a little concerned. It just seems to be a pretty important part of our licensing regulatory scheme work in the state for childcare, and I just want to feel comfortable that it's not too much power one person that can really determine huge outcomes for our childcare settings, and certainly want to be supportive of family childcare. So I don't know if the testifiers have any comments or if the department has an idea how much this is going to cost, or Senator Howe.
And Senator Franzen, I can tell you what I do know. Just to me, it just screams civil law here. So it's going to state government, and it just seems like since you're passing out confidential data, that would be a discussion point that by rights should be handled there. And I think the liability, it's a civil action. So, and so I believe the money they're looking for is ours. So I have a feeling that it may come back here eventually anyway. What's that?
Mr. Chair.
Senator Howe.
We don't have a new fiscal note, but I've got an old fiscal note.
Oh, sure.
That basically in the biennium of 22 and 23 would be $82,000 a year. So a total of.
How much?
$82,000 a year.
82,000.
So 164 for the biennium. And that's an old fiscal note from the 2019.
I think that helps give it a range. Senator Franzen, does that help you?
Yes, thank you.
All right, very good. Other questions? And so my just take on this, Ms. Wagner, it actually may save the department money. If you have one kind of target person that people can express their concerns to, it may actually, you may be able to repurpose some of your administrative staff that handle questions for the 9th time. And the clarity of what you mean may mean you don't have to travel the state so much. So there, just consider that all as you do this fiscal note, because I think there is a need for some kind of a person that can be a go-to individual. So that's all I think. Any other questions, thoughts from members? Seeing none, Senator Howe, closing comments.
Well, thank you, Mr. Chair and members. This has been something I've been working on since 2018 with Ms. Martini, and I would certainly hope that this is the year we can get this done, because I think we are in dire need of daycare out there, and I think this would help us. So
Well, thank you. And Senator Hoffman's motion is that be recommended pass and be referred to the Committee on State Government. Everybody understand that question? But the motion. All in favor, say aye.
Aye.
Aye. Opposed? Motion prevails. Off you go.
Thank you.
So, Senator Begum. Oh, no.
How
there?
are you? I'm here.
Oh, good. So it's not appropriate. Is it appropriate to mention that you might be celebrating a special day today or not?
Yeah, it's just a number. It's all good. And
like
regardless, it'll always be smaller than Senator Housley's number. So there we go.
Whoa.
Mr. Chair,
Senator Housley.
Mr. Chair, that was not fair. She's just, she shares a birthday with my husband, so every year
Why
I
I
gotta.
picked on her.
So Senator Begum, be good, or we're going to start singing to you. So Senator, let's see, who wants to move this? Senator Hoffman is a co-author. Senator Hoffman moves Senate File 1063 to be before us. And just so people understand what I think I understand, this is going to be heading off to civil law. And then it's my intention to bring it back here so we can try to find a way to meld in all the pieces and decide what we want to pay for about this. So at least all the pieces are together. That's meant to be a friendly action so that at least we can get the Senate position coordinated. And I appreciate Senator Begum taking the lead on this. And with that, Senator Begum, welcome to the committee.
Oh, thank you, Mr. Chair. I appreciate it. And I appreciate the committee having a very thorough hearing about this topic. I don't know, about a month ago. So this is Senate File 1063, and we have a lot of the department here, and I believe counties. There are a few others on the call that will testify related to the bill, but just to let folks know, and you can read a lot about this on NCSL's website. This family, the Family First program is a federal program, and it deals with Title IV and I think B and E of the Social Security Act. And so this is something that kind of the federal government has put onto us that we're trying to deal with here. And really the purpose of it is to provide enhanced support to children and families and prevent foster care placements throughout the provision of mental health, substance abuse prevention and treatment services, and have in-home parent skilled-based programs and kinship navigator services. So you can read a lot more about this on NCSL. They have a fantastic site about it. I'm gonna actually have Jennifer go over an amendment that the stakeholders and those that had concerns worked really hard on, Mr. Chair, and I'm really proud of that. And, this is a touchy subject. It's a difficult subject. It's a complex subject. And so I just really appreciate all the work that has gone in with the stakeholders, the department, and Senate staff, including Brittany, who's been phenomenal on this. So I do believe we have as much peace in the valley, if you will, Mr. Chair. For the most part, we're going to keep talking, though. We're going to keep talking on some things to even fine tune it better. And maybe that will come when we come back to your committee after going to Senator Matthews' committee. So with that, I'm going to turn it over to the department.
And thank you, and I appreciate that. And so maybe the discussion today could center on the negotiations and what the A3 does. And then just penciling in today, Senator Begum, if you're free, 2 weeks from today, we were thinking in the third deadline week to come back and revisit this and see if we can put it to bed. So that's a target. That's 2 weeks. Then our bill is due out a week after that. No, 2
Sounds
weeks.
good.
I mean,
One more
2 weeks
thing,
after
Mr.
that, right?
One
Senator
thing,
Bingham.
Yep, this does not have a fiscal note. This part, this does not.
Right, I get that. But just the package, we're just trying to treat it with the respect of a global package. So anyway, so Ms. Sommerfeld, welcome to the committee. And I thank you for being so frugal, Senator Bingham, having a bill that doesn't cost anything. So thank you.
Thank you, Mr. Chair and members of the committee. I'm Jennifer Sommerfeld with DHS, Children and Family Services. Thanks for hearing our bill today, and thank you, Senator Bingham, for being willing to carry this. This is our 2021 Family First bill on the heels of our 2019 and 2020 bills. As noted, we've been working with a handful of stakeholders, primarily Nami and Aspire, and we've also been working with MAXA to talk through parts of the bill and some of the existing statutes that were passed last year and previous years. So if you want me to go through the amendment, I will go through and just explain it. I don't have notes to go through section by section, but I'll go through the big points of what the amendment does.
That'd be helpful. And so let's, Senator Hoffman will move to A3 to get it properly before us, where my intention is to have your testimony and then the testimony of the other testifiers, and then we'll vote on it after that, based upon our input on testimony. Thank you, Ms. Sommerfeld.
Great. So parts of the amendment are simply technical changes. There's some correcting some syntax errors, I think, in some places where it's unclear whether parents are supposed to receive copies of reports in all cases or only if their children are a certain age. So you'll see a number of odd amendments in there about changing around child and parents and rearranging those things. So that's all purely technical. In the more substantive vein, the amendment clarifies that the qualified individual, or the QI, on the screening team must be trained on the assessment tool that will be used for the juvenile screening team. This addresses advocate concerns about who the QI will be and what qualifications a QI must have, while at the same time ensuring that we're not fencing out culturally specific providers that the agency and other stakeholders believe are central to ensuring families receive a culturally relevant and responsive screening process. The amendment provides greater authority for parents who choose to choose who is on the juvenile screening and permanency teams. There's some language in 260C that provides some additional authority to recommend who's on the team. And then also we're adding language to 260D that allows parents to really have much more control and choice over who will be on those teams. The amendment changes the timeline for when assessment of a child must be completed from the current language in law, which is within 30 days of placement, to having to occur prior to placement, unless there's an emergency requiring the child to be placed in a facility immediately. And then if there is an emergency placement, they will have 30 days after the placement to complete that assessment. This was added to address advocate concerns that allowing up to 30 days was too long and potentially would be disruptive to a child's placement. The amendment adds language to the certification article, establishing requirements for supervised independent living settings for youth ages 18 or older, which is one of the types of facilities that will still be eligible for Title IV reimbursement under the FFPSA, Family First. The amendment adds an instruction to the commissioner to develop aftercare supports through engagement with stakeholders, which will include counties and tribes by December 31st of 2022. It also strengthens language related to federal requirements that the permanency team recognize that placement with siblings is a priority by adding, in addition to the best interest, that the team must note that the reunification or placement with siblings might not be possible due to a child's specialized needs. And that's kind of at a high level, the amendment. If you have specific questions, we can certainly answer those.
Questions for Ms. Sommerfeld? Seeing none, let's go to testimony. Ms. Anderson? And we heard from you before. I'm just curious what you think about the amendment, the status of negotiations, and where the bill is now from you and Ms. Abderholden in particular, and then we'll hear from the county. So welcome.
Thank you. Good afternoon, Mr. Chair, members of the committee. My name is Kirsten Anderson. I'm with Aspire Minnesota, and we really appreciate the opportunity to continue the conversation around Senate File 1063 and Family First. As you know, Family First is one of the most significant reforms to federal child welfare in a generation. And so it gives us an opportunity to begin having the conversation around what is the children's service continuum that we'd like to build together. We hope to continue that conversation as implementation begins, as that question has not yet been addressed in this process and merits all of our attention as we move forward. Senate Bill 1063 reflects one area, Family First, focusing on treatment services found in congregate care settings. Earlier, we shared some of our concerns as language was first presented. Today, I want to share our gratitude for the ongoing discussions with DHS, MACSA, and Nami to develop language for implementation that meets critically important federal compliance requirements and seeks to preserve key values and service capacity for children and families. As Ms. Sommerfeld just reviewed the amendment, I won't go deep into the areas that we're most grateful, but a number of the items that she addressed were things that we found to be priorities. One thing that was not addressed that I did want to highlight is establishing an independent living setting certification to support youth transitioning to adulthood. So really appreciate that. And also, since we're in a process and on the record, I just want to mention two additional items that we continue to work on with the department. One is reviewing Family First impact on children served in settings with disability waivers and child welfare funding to ensure that system changes do not adversely impact key services being delivered to this unique group of children and youth. And then finding a mechanism to assess the additional costs of the transition for providers and counties to provide guidance on how those future costs can be addressed as our system continues to evolve and grow. We also hope that to continue these collaborative conversations to fully plan for Family First implementation as it is effective September 30th of this year. And just to close, these topics are rife with complexity. Children's service providers are not expert in all aspects of our funding and compliance systems. What our children's service providers do bring to this conversation is a commitment to collaboratively build a true continuum of services from family preservation to intensive services that our children, youth, and families want and need to support their lives today and their healthy futures. Thank you.
Very good. I'm glad to see the work that's gone on, and it's, it sounds like the people that are working with you on the open issues are still working with you. So that's partly why we're coming back in 2 weeks. Ms. Abderholden. Sue, are you there? Is she online? If we lost you, we'll come back to you, Ms. Abderholden. Let's just let her pop up and we'll move on to the, is she there? Well, let's just give you a chance to get tuned in. So, Ms. Sikora, why don't you go and then we'll come back to Ms. Abderholden. It's okay. Ms. Sikora, why don't you go ahead?
Good afternoon, Senator Abler and committee. My name is Becky Secor. I'm the Director of Health and Human Services in Beltrami County and also representing MACSA here today. Just want to thank you for the opportunity to talk about the Family First Bill and the perspective of County Health and Human Services. In our state supervised county administered human services system, our county staff are the folks responsible for locally navigating the federal changes that are about to take place because of the passage of Family First. To the bill at hand, counties opposed placement, To the bill at hand, counties opposed placement under 260D being removed from the broader Families First legislation. This would have created problems in ensuring proper oversight, assessing the appropriate services, and the ability of counties to capture 4E revenue for these placements. And MACSA thanks the author that in this bill, youth placed under 260D are included in the Family First legislation and the QRTP requirements. Counties recognize advocates' concerns regarding the requirements within Family First for both being placed voluntarily in residential treatment. MACSA is engaged with Nami in discussions about their proposal for developing another pathway for accessing and paying for residential treatment. We have outlined our concerns to them and will continue to engage in discussions about the development of alternative pathways with counties providing and preventing unnecessary duplication of protocols that would need to be implemented on the local level, ensuring protections for youth in placements continue, and supporting the parents' rights to advocate for the needs of their child. MACSA wants to thank DHS and stakeholders for their engagement around the amendment brought forward today. They reflect an important compromise regarding composition of the permanency team for 260D placements. The right composition of the permanency team ensures necessary and appropriate voices are at the table, determining what's most appropriate placement for children. Overall, MAXA supports this bill codifying necessarily language for the federal Family First implementation. However, there are still a number of concerns that remain amongst our membership regarding the impact of Family First implementation overall to services and child well-being system of our state. Relatedly, MAXA is continuing to work with DHS and on additional amendment we hope is incorporated into the bill. MAXA has shared draft amendment language with DHS and hopes that this amendment will be incorporated into the bill. Prior to the Family First implementation, the room and board costs provided and paid for by counties for children placed in corporate foster care settings was based on the state MAPC assessment, Minnesota Assessment of Parenting and Children and Youth. This is the tool that's used to determine the rate that the counties pay. A rate based on the age of the child, set in state statute and indexed to federal cost factors. This room and board rate is a small portion of the daily cost for corporate foster care placement, most of which is covered by the Child's Disability Services waiver as the care for costs of disability. For example, in Beltrami County, a MAPC on a person in corporate foster care could run up to $80 a day, and 4E would pay about 50% of that cost, or about $40 a day. We want to take into consideration those costs and have that language in the bill. Basically, Family First causes a change in the designation for the children's corporate foster care facilities, resulting in the MAPC no longer determining that board of rate for the facilities come October 21st. In effect, this would result in counties having to negotiate room and board rates with each of the over 100 programs across the state. Having counties engage in contract negotiations on room and board rates across the state by location could create new inconsistency in room and board rates and add administrative burdens to counties. Thus, we propose still setting a room and board rate statewide, trying to the MAPC basic rate already in statute that adjusts based on federal cost. This uniform basic monthly rate continues current practice, is simple and consistent and fair. We hope this amendment will be accepted. So in conclusion, we agree with we support the bill for Family First. We have appreciated the partnership with DHS, Nami, and other partners, Aspire. Anyway, the only concern we have right now that we'd like the amendment is to add that language that DHS would have the responsibility of negotiating those rates with the corporate foster care systems. And thank you for your time, and I'd be happy to answer any questions.
Well, thank you, Ms. Secor. I can't imagine the complexity of this, and I just have a hint as I'm, overseeing this project. So I hope you can sort all that out. I would seem like if you solve that question, the bill might develop a fiscal note, but thank you, and I presume that those discussions will be going on. Ms. Abderholden, welcome to the committee.
Thank you, Mr. Chairman. Members, Sue Abderholden, Executive Director of Nami, Minnesota. Apologize for my technical difficulties. Last year, when the legislature heard the department's bill to implement Family First, as you know, Nami vigorously opposed it. We did not want parents of children with serious mental illnesses to fully go through the child protection door. You directed DHS to meet with stakeholders to see if there was another way. Honestly, the task force didn't really bring us to a new solution. But DHS has worked more closely with us to address our concerns. We're still working on some issues. For example, we want to make sure that parents are solicited for the relative search in terms of who they should reach out to. There are lots of reasons why you wouldn't want, frankly, a relative to learn about your child's serious mental illness or to be involved in any way in that child's treatment and care. And I think we have to listen to parents about who they want that relative search going out to. The same would be true for the screening team. You're talking about a child's mental health needs, you're talking about their treatment. You as a parent want to have control over who is at that table. And I think there are many examples. You could have a child who frankly is in the LGBT community and you have a relative who is very much anti-gay, you don't want them at the table. You could have a child that you've adopted from another country who is a different color, and you, again, could have relatives that are somewhat racist, and you don't want them at the table. You could have different religion, different values, all sorts of things. So, you know, these are not parents who are bad parents. These are parents who have a child with a serious mental illness, and they should be able to decide who gets to be at that table. The other issue that's still remaining is being able to appeal these decisions. We believe that under Chapter 245, families already have the right to appeal. There's been some discussion.
Ms. Abderholden, you
Yes.
muffled out just as we said, the other remaining issue is, and then it was like 10 seconds of this.
Oh,
Say
sorry.
that sentence again, please. This technology
Sorry,
is
Mr.
gonna
Chairman.
be the end of us.
Is being able to appeal any of the decisions that are made. Under 245, we believe families already have the right to appeal. We want to make sure that they continue that right to appeal under 260D. Unfortunately, we still haven't figured out what that true alternative pathway could be. If we do not use Title IV-E funds, families do not need to go through the Family First process. So they wouldn't have to go through the child protection door. We are trying to figure out how under 245 that could happen, still having counties have a place at the table because they are using about 35 million of their own funds to pay for room and board and treatment. And then it's a little less than 3 million that's from Title IV-E. So we're working on that. I'm a little nervous about getting it done this session, honestly, because it's a pretty big lift, but we are going to try to do that. And I just want to say that the child protection door is really very different than the treatment door, even how things are reported. So, you know, as we were meeting, they were listing children as removal reasons. When children were removed from the home, they were actually placed in treatment. So I would just encourage us to continue to go down this path. If a child goes into a hospital, they don't need to go through the county. If a child goes to a PRTF, they don't need to go to a county. If the child has private insurance, they don't need to go to a county. It's only when they have Medicaid and need county funds do they have to actually go through the child protection door, or if they're using Title IV-E funds. So again, we just want to make this a better process for parents and their children. Thank you for the opportunity to testify.
Well, thank you, and I appreciate all the candid testimony. I think the appeal rights are important. I think the relative search is important. The screening team makes sense. I think the rates issue, I shouldn't give the department more ideas about setting up a statewide rate that's universal and simplified. Oh, sorry. Maybe anyway, so, and I'm concerned about the county cost and this other alternative that Ms. Abderholden mentioned, you know, the alternate path. But Senator Bingham, I know that you and Ms. Sommerfeld and the rest of you who are interested in this are going to be working hard on this. We're not going to solve it today. I was going to come back to you, Senator Bingham, so go ahead.
Yeah, Mr. Chair, and I don't disagree with one thing that Ms. Abderholden said. It's common sense, it's logical, it's the right thing to do. So we just kind of have to, I don't like to use a word like decouple, but we kind of just have to figure out how we're gonna do that. And it's not as easy as it sounds, because again, this is a very complex interwoven system and it's about the kids. And so, I mean, we want to get it right. And so we appreciate the flexibility. I'm a little bit more optimistic than Ms. Abderholden. I think, you know, I've been lifting a little bit of weights. You know, my shoulders are a little strong. I think we can get this lift this session. So I'm hoping we can do that. Hopefully we can by the time we get back to your committee, sir.
And so I shouldn't say a little wiser and that other word that goes with wiser. So that was just for Senator Housley. Anyway, I appreciate what you're all doing. And so, as I said, the plan is to bring it back here in 2 weeks. 2 weeks later than that, we'll be marking the bill up. There's time all along the way. 2 months from today is May 9th. We'll be in the thick of conference time. And I think I don't see this as anything partisan, which is why I consciously invited Senator Bingham to dig into this. And I really appreciate the leadership you're doing about this, even on your birthday, to come and present to us. I am eager for the best we can get, which I think is going to be pretty good. Anyway, so Senator Bingham, you want the last word, and then we're going to send you off to, what, civil law?
Yep. No,
Oh, we have to adopt the amendment, I'm sorry. Let's do the amendment, and then we'll give you the, so Senator Hoffman moves the A3 amendment. Any questions about that? All in favor say aye. Aye.
Aye.
Aye.
That's kind of random. All opposed? The motion's adopted, the amendment's adopted, the motion prevails, the amendment's adopted. Senator Bingham, last word, and then we're going to send you off to civil law.
Yeah, no, just would appreciate the committee support, their time, and we'll be back in a couple weeks, sir.
Well, thank you, and I hope the public understands our commitment to a really good project at the end, and hopefully we can get most of it done. So with that, Senator Hoffman renews his motion that Senate File 1063 is amended to be recommended to pass and be referred to the Committee on Civil Law. Everybody understand that? All in favor say aye.
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 Opposed? Off you go, Senator Bingham. Thank you very much. We're going to keep on going a little bit. Senator Hoffman moves Senate File 858. We're going to go till just before 3, and then we're coming back at 5. So, Senator Hoffman.
Thank you, Senator Abler, Chair Abler, and members. This advocating change together. This in the years past, there's been a guy named Rick Cardenas that has brought these to you, Senator Abler, and I don't.
Go ahead, say it.
It's amazing. He's just been, he's taught us about what it means to be treating people like people. And, when he set up the SAM programs and ACT, and he was out there every day providing information and awareness and advocating for change. I'll never forget when, when I first moved back to Minnesota to learn that there were 20,000 unmarked graves in the state of Minnesota. And who was the person that was driving the fact that people with disabilities that were living in institutions deserved to have their name on gravestones? It was Rick Cardenas. That's when I first was, got to know him. And I mean, I still know him, but he's right now ending his, here at time on earth because he had another stroke, Senator Abler. And it's just, as we're looking at this bill, the Senate File 858, I just absolutely wanted to say that, Rick Cardenas is a dear friend of everybody in this room. And you know what? I wish Rick was here presenting this bill. So, yeah. Senator Abler, with that, I know Mary Kay Kennedy is here, and absolutely Cynthia Gales, who has actually been part of ACT and SAM for a long time. And so with that, Mr. Chair, Senate File 858.
So Senator Hoffman moves to A1. Do you want to, so what you did was to make it, actually weave it into the existing program, keeping it much the same. Should we adopt that and then take testimony?
Yeah, Mr. Chair, I think we should adopt the A1 and then.
Any questions about the A1? Seeing none, Senator Hoffman moves to A1. All in favor, say aye.
Aye.
Aye. Opposed? It's adopted. And welcome to the committee, Ms. Kennedy and then Ms. Gales.
Great.
Hello.
Thank you, Chair Abler and members of the committee. Mary Kay Kennedy with the Advocating Change Together Center for Disability Leadership. So when you think of the rights that people with disabilities have, and the rights on paper, and the rights that they actually know about and are supported to exercise, there's really quite a disparity gap there. So what we do through our Self-Advocacy Minnesota network, the one that Senator Hoffman was just talking about that Rick was involved in launching, is we work with groups across the state to try to narrow that disparity gap. So one of the features of the network, the peer support network, is to get information out to people across the state about their rights and just help them connect with what the idea that they have personal power, they've got broader systems that are supporting these rights, and just providing some supports to get out there and enjoy life with everyone else in the community. So the really fabulous news is that when we do provide disability inclusion supports, and when we provide self-advocacy trainings to folks, it really does make a difference in helping people expand their idea about what is possible in this world. So these kinds of supports, and we think are a really good investment to really help Minnesota meet our integration goals. So one of the things that we think about is that even though the state is really super committed to these concepts, the state investment in actually funding the work really has not kept pace with the need. So I guess, just to be really honest, the self-advocacy movement and this kind of work is really woefully underfunded. So what we're hoping to do is to work with you just to get the resources we need to continue the state network and to continue the work of making these beautiful rights that people have in statute and on paper, to make sure that they're a lived experience for folks with disabilities across the state. So I guess that's it with what I have to say. And one of our members, Cynthia Gales, wants to just talk for a few minutes about what some of this means to her.
Welcome, Ms. Gale. So glad you're here. Welcome to the committee.
Thank you. Good afternoon, Mr. Chair and members of the committee. My name is Cynthia Gales, and I just want to say that the ACT program, Advocating Change Together, is an excellent program. I was one of many people with a disability that didn't know about disability rights. I was told what to do, when to do it, and how to do it, and made to feel like it was in my best interest, which that at all times it wasn't correct. So I'm in the program now, and the program has helped me with my self-esteem. I can now advocate for myself and let people know what I need to do the things I want to make my life livable. And I just want to say that the program is very well. And I wish when I was younger, in my younger days, that I had knew about this program. I am so proud to be part of this program. And not only am I saying that the program works, but in December, on behalf of ACT Advocating Change Together, I accepted the National Human Rights Education Award. So I'm not the only one thinking that it's working. There's other people out there thinking that it's working too. And I just want to say thank you. I'm so proud of being a part of the program. Thank you.
Thank you, Ms. Gales, and Mr. Cardenas would have been impressed and just so overjoyed to have you here. So, questions from members? Seeing none, Senator Hoffman, last word.
Thank you, Mr. Chair and members, and this has been part of our ongoing project to get, person-centered, individual rights, access, and again, I go back to what I said earlier, Mr. Chair and members. If it wasn't for Rick Cardenas, we'd still have unmarked graves that people with disabilities that lived in state institutions. They didn't even get their name put on a grave marker. And so, what this act does and what Sam does with the self-advocates in Minnesota chapters, it absolutely is worth every investment, because it gets to where. Look at Cynthia. She got a national award. Congratulations, Cynthia. I've known you for quite a few years, and I'm proud of you for that. So, Mr. Chair and members, thank you for hearing this bill, and I hope it passes.
Thank you, and that'd be Cynthia, the rock star. With that, in honor of our good friend Rick, the bill is laid over. We're going to actually jump ahead to Senate File 1257 that has a committee report that has to get done. So, Senator Benson, Senate File 1257, and you have some amendments.
Thank you, Mr. Chair and members. I'm going to move Senate File 1257. The base bill right now, licensed medical providers, so people licensed by the Board of Medical Practice, have to have a license for the board and a license to work in facilities, but DHS requires them to have a license as well. And as I've been digging into this a little bit further, and thank you to the folks who've been doing the research on this, we have contradicting statutes. So 245A specifically excludes nursing homes and hospitals that are licensed by the Department of Health, and yet we have background checks going back to the Department of Human Services. And what this does is have licensed medical professionals have to go get an additional background check through the Department of Human Services. 2 background checks to work in a facility licensed by the Minnesota Department of Health. And so I'm going to ask my testifier, Ms. Grinke, to walk through some of the problems that this is causing, and then I'll move on to questions and amendments not directly related to this bill, but still germane to this bill.
Welcome, Ms. Krinky. If you could give us a brief walk through the problems that you see. So thank you. The brevity increases the chance your bill might pass. So.
Okay, great. I'll go quickly then. Thank you, Mr. Chair and members of the committee. For the record, my name is Mary Krinky, and I'm with the Minnesota Hospitals. And we are here today to testify in support of Senate File 1257. Simply stated, the bill eliminates the burden on providers and employers from having to do a duplicative background check with the Department of Human Services if the individual is duly licensed by their appropriate health licensing board. That would include the Board of Medical Practices, the Board of Nursing. So just real quickly here, we note that hospitals also do their own background checks prior to screening a prospective employee. And it's our highest concern to keep our employees as well as our patients safe. And we certainly support one background check being done by a government entity. So the licensing boards would do a background check as well as a fingerprint. I just want to give you two quick examples of how this has been kind of confusing and frustrating for us. So a registered nurse is employed by one of our healthcare systems. They currently work in a clinic setting. They have accepted a position to now go work for the same hospital system, but to work in a hospital setting. So we have been, under the past few years, this individual, if they're working in a clinic setting, a doctor or a nurse in a clinic setting does not have to get the DHS background study completed. But if they move to a hospital or nursing home system, they do have to get that additional background check done. So it's been very confusing to us. If we have employees in a clinic setting, they only need their health licensing board background check done. But if they move over to the hospital or nursing home, they have to get the additional background check done. I want to give you a second example. A new graduating physician coming from another state wants to practice medicine in Minnesota. This is terrific. This individual has to get all their credentials done. They have to get they have to become a licensed Minnesota physician. They have to get the background check done. They have to get the fingerprint done. And that's all to be a licensed physician. But if they get a job with a Minnesota healthcare hospital or a system, then they have to get a second DHS background check done. And that requires us frequently to have to fly them into Minnesota, pay for a hotel, pay for their transportation to one of the limited fingerprinting locations to get that done. The Department of Human Services, and this has been part of our struggle with this, has a single vendor contract. And it has very specific requirements for where the fingerprint can be completed and how it has to be submitted to DHS. It has to be through their single vendor and their vendor contract. While MHA strongly supports eliminating this duplication in the background check, it could be greatly improved and it could be enhanced with just the ability to accept fingerprints from multiple vendors, and if it could be submitted electronically. Those two changes would be of big assistance to us. And this also has to be available for out-of-state individuals. We know the department is trying to fix this situation, and Senator Utke has another bill that we are working on. There are currently some 130,000 individuals who need to get their background check completed. The other day, the department estimated that could rise to as many as 200,000 people. So we are very anxious about this fingerprinting issue. We believe that the department, if they could eliminate this for the licensed healthcare professionals, they would have less people that they have to get through the process right now. So we are meeting with DHS, we're meeting with other agencies. We know that this is a very complicated issue, but we also are very optimistic that something can be done to help streamline this duplicative process. So thank you, Mr. Chair, and we want to keep working on this.
No, I appreciate that. So Senator Benson, let's take up the amendments, I think.
Thank you, Mr. Chair. And to the A1 amendment, this amends the Net Study 2.0, instead of one vendor, the department would have the flexibility to have up to 3 vendors, so there could be a competitive bid, or there could actually be 2 vendors in the state of Minnesota. And so, Mr. Chair, I'd like to move the A1 amendment.
Yeah, thanks. And so Senator Benson moves to A1. It seems to me you wouldn't even have to limit to 3, but I'll not step on your amendment today, so.
Mr. Chair, if you want to amend, I will take your amendment.
We'll see it again. This is going to your committee. So everybody understand the amendment? Any questions about it? I don't see any hands. Well, Ms. Senator Franzen. Oh, Wickland, I'm sorry. Just not thinking today. Stayed up too late last night. Go ahead, Ms. Wickland, Senator Wickland.
Mr. Chair, yeah, I guess I just wondered, what's the plan for this bill? Are we going to have a chance to discuss this more, or if we only have 5 minutes till we have to stop? Or
It's going to go to the Health and Human Services Committee.
okay, so I guess I would just be interested in knowing how DHS feels about it, and how you came up with 3 and so on. But if we're going to have more chance to discuss later,
I'd like the bigger number. Oh, DHS, if you want to testify, I'm not going to deny you that opportunity.
And
So,
Mr. Chair,
Senator Benson.
to this amendment, we had in statute 1. I have no idea why 1 is there, but I know that the current vendor having limited sites is not workable, and so I wanted the department to have the freedom to say, we're going to go out and have more flexibility. If we want the number to be 10, if we want it to be unlimited, then let's have that conversation with DHS. But I want to get something moving as we start the fiscal note and budget process.
Who wants to testify for the department? Mr. Burdick, are you doing that again today? Welcome back. Nice to see you again.
Thank you, Mr. Chair. Matt Burdick with the Department of Human Services. We've been working with Senator Benson on this and other ideas related to background studies and appreciate that collaboration. We agree there's probably a good conversation to be had about how expansive we could be in terms of allowing multiple vendors, especially in unique circumstances like this. And so we don't have a specific number in mind either, but welcome continued conversation on that front.
So the department generally is favoring freedom then, so that's good to hear. So any other questions about this? And thank you, Mr. Burdick. Sorry. Any other questions on the A1? All in favor say aye.
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 The motion prevails. The amendment's adopted. Senator Benson, do you have another amendment?
Thank you, Mr. Chair. And to the A2 amendment, as Ms. Krinke mentioned, during COVID, we have not been having in-person fingerprint background studies. We've been doing non-fingerprint background studies, and we're going to need to catch that up once the emergency order is lifted. And so right now there's a backlog of 135,000, could go up to 200,000, and this is a way to compel, encourage the department to contract with an additional vendor or additional resources to go into those facilities that have 50 or more staff who have not had fingerprint background studies and get them taken care of. Let's start getting people moved through the system. There's a problem with the date being August 1st, 2021, but I'd like to work on that between here and the next stop as we get some sense of what a fiscal note would look like. And Mr. Chair, we're trying to take this money from available federal COVID money so that we don't have to use general fund money to catch up on something that really is rooted in COVID response and protecting people in these facilities, not having them go out and be exposed by getting digital fingerprints. And so that is the A2 amendment.
So Senator Benson moves to A2. Senator Benson, there was also discussion about some employers have already undertaken this activity themselves and they have brought it in-house. Might that be a friendly discussion in
And
the other
Mr.
committee?
Chair, I'm very open to that discussion, and I think we should make some of our COVID funds available to those employers who've had to do, they have to pay for the first background study, but then if they have to do a supplemental for fingerprinting, let's use some COVID funds to help pay for those.
And thanks, Senator Benson. I did ask my sheriff about this. Happens to be your sheriff as well. And he's a mighty fine sheriff. And so I asked him about this fingerprinting. We were told that there's this hard card that goes on. Actually, our sheriff, most of the sheriffs in the state have glass things that they they put them on the glass and then they go digital. The FBI requires the hard card. Is that not novel? So I think that we're not getting away from that, but I think there's even an opportunity there. And he said, of course, there'd be a fee, and I think they'd be happy to do it for $20. So let's keep working on that. So
Let's keep working, Mr. Chair. We've got quite a backlog, and the more places you could go to get FBI fingerprints, the faster we'll clear that backlog.
And so this would be the even more freedom amendment. And Mr. Burdick, I won't have you come and tell us that you like even more freedom or not, but do you need to say anything about this, Mr. Burdick, seriously, or is it okay to, you want to say anything?
Thank you, Mr. Chair. Just would say that we're continuing to work on this one as well. Definitely appreciate the spirit of having as many fingerprint sites as possible. It does get complicated with the FBI and other just complicating factors that happen in our background studies area, but want to keep working with the senator because we definitely agree with the intent of the amendment.
Yeah, thank you. And I appreciate that tone. I think this is, you have a couple 100,000 to get caught up on. And I think I want to commend the department for realizing that that's a lot. And the concerns of some of the providers is there's no way they can be ready in like 60 days and so on. So this discussion has moved right along very well. Seeing no more questions, all in favor of the A2, say aye.
Aye.
Aye. Opposed? Amendment's adopted. Questions for the bill for the author? To the bill for the author. Anybody? I think this is a great bill, and I hope and I appreciate the tone that's behind this on all sides. So, with that, Senator Benson, do you want the last word, Senator Benson?
No, Mr. Chair, the FBI doesn't allow us to transfer fingerprints, by the way, so that's a little complicating. I've learned more than I ever wanted to, and Mr. Burdick has been a great partner in getting this done. They are motivated to clear that backlog and to make this work. So I will keep working with them. The stakeholders obviously are interested. I appreciate the accommodation for the amendment so that I can get a fiscal note and we can get a sense of what this is going to cost us. And with that, Mr. Chair, if I may, I'm going to move Senate File 1257 as amended be recommended to pass and sent to the Committee on Health, Human Services, Finance, and Policy.
Very good. Senator Benson renews her motion that it go off to a friendly place. All in favor of that, say aye.
Aye.
Opposed? Off it goes. The motion prevails. The bill is moved. We're going to recess in a second. When we come back, we're going to take up Senate File 1350, right, as the first bill, and then we're going to resume the order. So we got through 6 bills. That's pretty good, I think, and 3 really major works of legislation. Yes, Ms.
Johnson. I just want to remind members that there's a different Zoom login for this evening. So if you try and log into the meeting for right now, you'll not be able to get in. And so testifiers and members of the public who are on, and we didn't get to your bills, I will make sure you have that login.
That means a new code, too, so, oh, no. It's 3 o'clock. We're right on time. Thank you for everybody's good work, and with that, we're in recess.